Welcome to the MoCA Prep course, a step-by-step guide to help you master the Montreal Cognitive Assessment, MoCA. Whether you're a healthcare student, professional, or just want to understand or administer the MoCA, you're in the right place. This course is built for test readiness. Each lesson clearly explains the MoCA's format and scoring, what each task measures, and how to confidently interpret results. We focus only on what's actually tested. No off-topic tips or general memory tricks. Let's start with a quick overview of how this course will support you from beginning to end. What is the MoCA and why does it matter? The Montreal Cognitive Assessment, MoCA, is a clinical screening tool used to detect mild cognitive impairment and early signs of dementia. Unlike basic mental status tests, the MoCA dives deeper. It evaluates attention, executive functions, memory, language, visuospatial skills, conceptual thinking, calculations, and orientation. Here's what makes the MoCA unique and test-relevant. Brief but thorough. It takes about 10 minutes but tests multiple domains. Sensitive to early decline. It can detect issues before they become obvious. Widely accepted. Used globally by physicians, psychologists, and nurses. Scored out of 30 points, with a recommended cutoff of 26 for normal cognitive function. By the end of this course, you'll understand not just how to complete the MoCA, but why each part is included and how to interpret responses accurately. The most tested concepts. Know these early. In preparing for the MoCA, some tasks are more commonly emphasized than others, either due to scoring weight or the complexity they present. This course will revisit each in detail, but here's an early snapshot of the most testable concepts you need to be familiar with right from Lesson 1. 1. Visuospatial, executive function includes trail making, alternating numbers and letters, like 1A, 2B, clock drawing, cube copy. These tasks assess planning, organization, and visual reasoning. They are commonly misunderstood, so we will give extra attention to proper sequencing and error recognition later in the course. 2. Delayed recall. Tested by asking the patient to remember a list of 5 words after a delay and interference task. This section holds 5 points and is one of the most heavily weighted. You'll learn how the scoring changes based on cueing and which mistakes are most common. 3. Language tasks includes naming animals from complex drawings, e.g. camel, lion, rhino. Sentence repetition. Verbal fluency. Generate as many words as possible, beginning with a certain letter in 1 minute. These tasks test expressive and receptive language, a critical part of the MoCA. Mispronunciations, hesitations, and substitutions all affect the score. 4. Orientation questions. Straightforward but high-yield date, location, city, and situation. This section provides quick points but must be exact. Monday instead of around the weekend makes the difference. We'll explore scoring rules and how to avoid common traps throughout the course. What to expect in this course? Here's how this course is structured to help you succeed. Module-based learning. Each module focuses on specific MoCA components like memory, attention, or language. Section-by-section walkthroughs. You'll get guided examples and walkthroughs for every MoCA item, no guesswork. Scoring strategy tips. We'll highlight what's most likely to be tested and where errors are most common. Realistic practice prompts. Later modules will include exercises that reflect exactly what you'll see on the MoCA. The goal is to make sure that when you're faced with the actual assessment, whether you're taking it, administering it, or analyzing it, you'll know exactly what to do and why. Your role in learning. Whether you're here to learn how to administer the MoCA or to understand your own results better, your focus should be on understanding why each task is used, what cognitive domain it targets, knowing the rules for scoring, especially partial credit or errors, practicing core testable sections like delayed recall and visual tasks, recognizing what a low score in each section may indicate. As we move forward, you'll gain the tools to think critically, apply clinical reasoning, and explain MoCA results with confidence and clarity. Lesson recap welcome, and what's ahead in this first lesson you learned. What the MoCA is, and why it's an essential cognitive assessment tool. The most commonly tested and highest scoring sections: visuospatial executive tasks, delayed recall, language tasks, and orientation. How this course is structured to prepare you for real-world MoCA application. This course will guide you section by section, breaking down tasks, scoring, and interpretation, so you feel fully equipped.